Niemann-Pick disease actually describes a family of disorders which are biochemically and clinically separate. There are basically two groups of disorders. The first, which are often called Niemann-Pick Disease Type A and B, are genetic disorders that result in deficiency of an enzyme called acid sphingomyelinase. The second group, if you will, is Niemann-Pick Disease Type C, which has had many names over the years. It's quite a separate disease, and really the diseases were grouped together through an historic misunderstanding that began in the 1950s. Niemann-Pick Type C disease is a genetic disorder. It's autosomal recessive, which means that affected individuals have inherited one abnormal copy of the gene from each parent. So the parents themselves are carriers. They have one normal copy of the NPC gene and one which is mutated. The consequence is, of course, each time they have a child, there's one chance in 4 that the child will carry this disease. 2 distinct genes cause the same disease. Mutations in the NPC1 gene account for about 95% of cases of NPC. Mutations in the NPC2 gene account for about 5% of cases. The consequence of mutation in this gene is that cells are unable to move large molecules through the endosomal lysosomal system. And this is a system of vesicles, compartments within the cell, which move large molecules around and facilitate their metabolism. And so when this system is disrupted and the trafficking is blocked, it's a little like creating a traffic jam in a large city. You have gridlock, and instead of cars and traffic backing up, you have a backup and an accumulation of large molecules. Cholesterol is particularly important in this regard, specifically in the peripheral tissues, the liver, the spleen, the lungs, the lymph nodes, but it is also maldistributed in the brain, and other molecules, lipid molecules, fatty molecules that have sugars attached, which are called glycosphingolipids, also accumulate. There are a number of downstream consequences. There's an inflammatory response in the brain. There is abnormal signaling between cells, and this triggering of the death pathway for cells, so-called apoptosis. And the consequence of this is there is a gradual loss of cells in various organs in the body, and most specifically, a loss of neurons in the brain, which is reflected in the symptoms and signs of Niemann-Pick disease type C.
The symptoms of Niemann-Pick type C disease could be quite diverse. It really depends on when the disease onset is. In patients with the disease onset earlier on in the first year or 2 of life, they often present with liver disease, jaundice, they may have really large liver and the spleen. Then the neurological symptoms may come, and they may come early, soon after the liver disease starts, or it can come many years later. And the neurological disease is really what the main problem in Niemann-Pick type C. The neurological disease could start with just abnormal eye movements when patients can't move their eyes upwards. Then it progresses and the patients could start losing their balance, they lose their cognitive skills, their speech becomes much more difficult to recognize, they may have drop attacks or a full-blown epilepsy. And then progressively the cognition, the thinking skills become less and less. Dementia progresses. The patients lose their ability to communicate, to feed themselves, and really that's when the last terminal phases of disease start. And this can happen earlier on in the early childhood, or it could be more commonly in the adolescence, but in some patients it really happens way into their adulthood. So Niemann-Pick type C disease diagnosis is made either by biochemical means or by genetic means, ideally both when you can confirm the diagnosis both biochemically and genetically. Actually, the centers which are expert in diagnosing these patients have a lot of experience in diagnosing and looking after patients with Niemann-Pick Type C. There is quite a standard way of doing it. The problem with the diagnosis comes where the patients, it takes a long time for patients to get to these expert centers from the time when the first symptoms start, because they are quite non-specific, until the time when they get to the referral to expert centers. And this could take many, many years.
Niemann-Pick disease type C is a treatable disorder. Most importantly, every patient can be treated. We can treat the symptoms. We need to provide support to the affected individuals, their families, and develop a community of support. That in itself makes a huge difference in the outcome of this disease, and it's something I've had the privilege of witnessing over the last 25 years since I've become involved with families with this disorder. Perhaps even more encouraging, though, disease-modifying therapies are becoming available. Miglustat is a drug which inhibits the synthesis of glycosphingolipids, which are fatty molecules linked to sugars which accumulate in the brain in Niemann-Pick disease type C, and which we know are responsible for some of the malfunction of the brain and loss of tissue. There is evidence from clinical studies that this has a modest benefit in slowing the progression of disease. Several clinical trials are currently underway. One of these is looking at the effect of cyclodextrin, a molecule which removes cholesterol very effectively from cells, including neurons. Another trial, which is beginning, uses a small molecule called arimoclomol to stimulate the production of heat shock proteins, which are able to counteract some of the serious downstream consequences of Niemann-Pick disease type C. And finally, there's a trial underway looking at a drug called varinostat, a so-called histone deacetylase or HDAC inhibitor, which also counteracts some of the downstream consequences of the Niemann-Pick C mutation. Finally, patients who have Niemann-Pick disease type C2 have a mutation that affects a different molecule than NPC1. The NPC1 molecule is a very large protein which sits in membranes, and it's not suitable to be replaced or transduced. However, the Niemann-Pick C2 molecule is a small molecule which is soluble and which can be potentially transferred from one cell to another. And so in the very small group of patients who have mutations in this gene, hematopoietic stem cell transplantation, which we formerly called bone marrow transplantation, may be an effective strategy. And although there's very limited data, we do have some evidence that this may be very helpful to patients affected by this form of the disease.